This episode is on DJ Stenting. This is part 6, take 3.
If there is one procedure which a rural surgeon has to learn, it is DJ stenting and maybe DJ stent removals. This is because when we are traveling to remote areas in India, we found that every month at least there are 1 or 2 patients who come with acute renal failure because of ureteric stones in both the sides. A simple procedure like DJ stenting could have saved the kidneys. So, this is a double J stent. It is called DJ stent because it is a shape of a J on either side. So, one end stays in the kidney, the other end in the bladder. So, normally when you are passing the DJ stent, you will notice that it goes in with difficulty into the ureter, because normally ureter is a collapsed tube and it opens and it is only the peristalsis which pushes the urine down. So, when you leave a stent like this, it keeps the ureter open all the time, and also the ureter dilates to about 2.5 to 3 times the original size, and the movement of the stent while walking and the flushing which occurs, all these things try and force the stones outside the body. So, almost all the stones under 6 millimeters and up to 12 millimeter stones can pass just by DJ stenting. So, for DJ stenting we need a guide wire. Unfortunately, this is not the correct guide wire. The general guide wires are much longer than this, and they always have one pointed end and one floppy end, and it is a floppy end which goes inside the body. But it is difficult to just pass the guide wire through the working channel or the scope. So, that is the reason we use pusher that is used for making the guide wire stiff, and then we introduce it into the ureteric orifice. So, once it locate the ureteric orifice, you push it in. So, we will go to the indications later. So, the way to locate the ureteric orifice is that you look down from the bladder neck, you will see the interureteric ridge, and if you trace a ureteric ridge on either side, you will come across the ureteric orifice which opens like this. So, you take the pusher and guide wire near it and then push it inside. So, then once the guide wire goes in, you keep pushing it till there is resistance and the guide wire does not go in anymore, which means that it has reached the renal pelvis. And then the way to take it out is to you push and pull. So, you push the guide wire 1 centimeter, pull it out, push, pull like this till the whole thing comes out, then you can take it out. So, once you do that, the next step is to straighten and push the DJ stent over the guide wire. Here one other thing you need to notice is, note is that if the DJ stent is bent like this, it will not go easily. So, you need to hold it straight and stiff, but at the same time you should not pull it out. So, hold the hand close to the body so that the position is fixed, then keep pushing the DJ stent. Okay. Then once you do that, then you thread the pusher, and again unfortunately it is not long enough. So, we are doing this. Then again the same principle, you have to hold it tight and keep push the stent inside. Once it goes in, you remove the guide wire, and after the procedure you need to make sure the patient is advised to drink enough water to pass about 3.5 or 4 liters of urine a day, so that the stones come out. Thank you.
Thank you.
Yeah. I think Anyway, tomorrow we need to, if they can get the correct
Wire.
guide wire, it's a long one.